Brilliant. We are recording our session this afternoon with Dr. Clare Spencer. So do turn your cameras off and pop yourselves on mute. If you do have any questions, you can pop them into the chat and we will get round to them at the end of the session. Dr. Clare, first of all, I'd like to thank you so much for joining us today. It's lovely to have you back with us.
Oh no, it's really lovely to be asked. Thank you.
And happy Menopause Awareness Day.
And the same to you. No, it's great to be talking here on this particular day. So no, thank you for inviting me.
So for those of you who don't know Dr. Clare, Dr. Clare is a registered menopause specialist as well as being a GP. She qualified from Cambridge University and holds a membership of the Royal College of Obstetricians and gynecologists, at the Royal College of General Practitioners and the British Menopause Society. She's part of the Medical Advisory Committee, and as if that's not enough, she's also the clinical director of My Menopause Centre, which leads a large NHS menopause service in Leeds, and is also a BMS menopause trainer. Before we start, can you tell us what that is, a little bit about that part of your role?
Yes, no, definitely. So the British Menopause Society offer quite formal and very rigorous evidence-based training in the menopause. And so to apply to be a trainer, you have to guarantee that you see a certain number of specialist menopause patients per year. And so I take 1 or 2 or sometimes 3 trainees at a time and train them in the menopause, usually GPs who are interested, which is great because then they go and spread the word and just really helping to increase awareness and knowledge for GPs where it's really needed.
We are in safe hands. We are clearly in safe hands. So thank you again. For those of you who are new to Aromatherapy Associates, I am Christina Salcedas. I head up the education department for the brand. We are a British, nearly 40-year-old British aromatherapy brand, started off by 2 British aromatherapists who were sharing the power of aromatherapy, and they were working in clinic, blending oils to make sure that actually each and every individual person that came in was treated as an individual with essential oils. But today's topic is very poignant. We have, it's World Menopause Awareness Day, and it is beyond me, quite frankly. When I start reading sort of all your notes, Dr. Clare, I just think, my gosh, menopause, a bit like periods, and a little bit like any kind of females' health or hormone-related issue. It is not something that's just sort of come about, and but it was seen to be so taboo, which is bizarre considering how prominent it was in society, and how the fact that half of the population, of the world population, is female. So can you explain to us why it's really important to continue to have these conversations about menopause and the treatments that are out there, as well as what we're expecting to find, what symptoms we're going to expect to find?
No, absolutely. So let's break that down into sections. So why do we need to have the conversation? And I think that we've come such a long way in the last 2 years with lots of television programs, stories in the media, but we still have a way to go. I think menopause still is taboo, and it's bonkers when every single woman will go through the menopause at some stage in their life. For most, it will be a natural transition. Some women may be plunged in with a surgical menopause or medical menopause. And right now, there's estimated 15.5 million women in the UK at some stage in that transition. So huge numbers. And when you think that there are 4.3 million women aged between 50 to 65 in work in the UK, and that's almost half the workforce of this age group, that is. And that's 75 to 80% of menopausal women are in senior roles, or just, when you think about the wealth of experience that those absolute numbers contain, yet we still know that about 10% of women have left their jobs because of the menopause. from research that was conducted by the Fawcett Society for Channel 4. And, you know, and I speak to so many women who've left their jobs, who have taken a lesser role, who have not gone for promotion. So, you know, the numbers behind the numbers under that 10% umbrella are really huge. So it's brilliant that we're talking about it today.
Obviously, you've kind of already sort of touched upon the fact that it's impacting women's sort of jobs and their careers. In what other ways is it impacting females?
Yeah, so if we think about the range of symptoms, which I know that we're going to come on to, but, you know, in surveys, we know that around half of women say that it's had a negative impact on their home life, half negative impact on their sex life, 4 in 10 negative impact at work, as we've touched on, and 3 in 10 negative impact on social life, which are really, you know, when you think about it, the sort of widespread. If the woman in the family is affected, it doesn't just affect her, it affects partner, children, elderly parents. You know, I talk to women who just say that they want to not go out anymore, you know, the motivation is lacking, and so then friendships are affected. So I know this is the doom and gloom bit, and we are going to talk about all the positives of what we can do, but it sort of reiterates why it's so important that as a society we address this, and women are educated so they know what to do to get themselves out of the quagmire when you just feel that you're in the midst of all of those symptoms.
Yeah, I think that's the kind of the key message as well, is actually it isn't all doom and gloom. There are things that we can do. And so what are the main things that we can make it into a less negative experience, and almost kind of empower us to be able to, you know, confront this in a much more positive way?
Yeah, well, I think we're doing that right now by talking about it, because I know it's a cliche, but really knowledge is power. And we ran some research with Britain Thinks that showed that really clearly the women who were most prepared for the menopause were more likely to see it as a positive transition rather than negative. And the women who were prepared felt less likely that they just needed to cope. And so I just think it's education, and understanding the symptoms, why they come about, and then the impact of those symptoms.
You are right, absolutely. That it is all about knowledge. Knowledge is definitely power. So can we go right back to the beginning? And you know, I for one, I've just turned 40, so you know, I'm preparing myself. I want to make sure that I understand as much as I can now. So when it comes to it, it's not a shock, and it is something that we can kind of do in a different way and address it. So let's go back to basics. Can you tell us exactly what menopause is, for those of us who want to know a little bit more?
Yes, no, absolutely. So the word menopause actually means end of monthly periods, but it's far more of a transition rather than a single point in time. So if we think before the menopause transition occurs, from puberty, our estrogen level, so that's a really important female sex hormone made by the ovaries predominantly, and our estrogen will fluctuate up and down rhythmically, literally like that, every single month. And for most women, that will give you a monthly period. So if you can imagine, there's a really tight feedback mechanism needed to keep that regular fluctuation. So at the start of the menopause transition, that feedback mechanism starts to break down. So what happens is the dips of estrogen get deeper. So your estrogen level on average drops, and you get more wilder fluctuations. And so that's the start of the perimenopause. And that's when symptoms can really start to insidiously creep in. And then that period of time can last for 5, even up to 10 years. In some women, that might be mid-40s, it might be early 40s, some even younger for some. And then what eventually happens is the feedback mechanism completely breaks down. So your estrogen levels are low, and they stay low, and then they're low forevermore. So literally the menopause is a single point in time when you can look back and say no period for 12 months. And then you're immediately into the post-menopause. But it's so confusing, isn't it? Because symptoms can start early in that menopause transition and can carry on into the post-menopause as your body adapts to that state of low estrogen, your sort of new normalness. But the positive is, for most women, symptoms will gradually get better in the post-menopause, even if you don't do anything about it.
You've touched upon sort of the kind of the key things in terms of what should we be looking out for in terms of symptoms. I think we all kind of know a few of the most common ones. You know, your night sweats. Now a lot of people talk about brain fog, which is something that actually, you know, I hadn't heard of until most recently. You know, what should we be looking out for? What are the most common ones, and what are the ones that aren't so common that we can expect?
Yeah, no, great question. So obviously change in periods, if you're having periods, are one of the first signs. But if you say got a Mirena coil, or you're taking the mini pill and you're not bleeding, you can't always go by periods. So brain fog is an early sign, and that's where your brain just feels full of cotton wool. You can't remember things that you're told. You can't think of the word that you know is on the tip of your tongue. Really frustrating.
Yes.
Anxiety is really quite common, because that big erratic swing of estrogen can trigger anxiety, can trigger headaches and migraine for some women. And then when the estrogen level is low in that trough, you can have, as you've said, hot flushes, night sweats. So, but also there's that slow creeping in of weight gain around the middle as we redistribute fat, as the drop of estrogen changes our metabolism. Aches and pains are quite common, and particularly quite common early on, because estrogen keeps joints lubricated. It acts like a bit of an anti-inflammatory in joints. So generalized aches and pains are quite common. Bladder issues for some women, so high sensitivity, the vaginal dryness, vaginal soreness can occur quite early in that transition. It's not just a postmenopausal issue. And then some of the lesser known symptoms are a bit weird and wacky sounding, like burning mouth, or there's a symptom called formication, where it feels like you've got creepy crawlies just under your skin, or some women get like shooting electric shock like pains as the loss of estrogen affects their nerve endings. So quite a range. I think if you look at our website, we've listed 38, but you know, that there are a lot of symptoms, but they don't all happen, and they don't all come at once, and they may ebb and flow. And so it's just good to be aware of them. So you've got some understanding. You're not thinking, oh, what is going on? Have I got early dementia? That is really super unlikely. It's more likely that it's the menopause and hormones.
Everything that you've kind of told us, obviously, you know, you are an expert in this field, and you must, you know, you speak to hundreds, if not thousands of women. What's the kind of thing that most typically surprises people that you talk to when you're talking about menopause?
That's a great question. So I think it is the mood symptoms. Most people have heard of hot flushes, but it's that it's really affecting, isn't it? That sort of lack of enjoyment, that loss of motivation, that can translate into so many aspects of life, including low libido. Aches and pains, often women are quite surprised to find out that they've got better when they've taken HRT, if they're going to take HRT. So, but I'd say it's the psychological symptoms and the symptoms that impact at work. So many women say, you know, it's stress, I'm just stressed, or I've got to juggle a lot of stuff, and it's my lack of ability to juggle. But no, it's probably your hormones changing that are making you feel that way.
You know what, well, the one thing that actually surprised me was actually the age, as in it's not something that it's not unheard of to be as young as, you know, as 40 to kind of go into that state. So yeah, it's hence why I think the conversations need to continue, and you know, you're doing a great job to be able to do this and making sure that the message is spread as wide as possible, really. We are aware, obviously, those are kind of your things you're looking out for in terms of sort of long-term consequences of menopause. Can you talk us through a few of those, please, Dr. Clare?
Yeah, no, completely and utterly. And isn't it interesting, just going back to your previous question, that I didn't say age first? And that's because I think awareness is increasing. And so I am seeing younger women coming forward now and talking about the perimenopause. Sorry, just as an aside, that's really interesting, different views. No, so long-term health consequences of the menopause. So when we lose estrogen, we increase our risk of osteoporosis because we need estrogen to make sure our bones stay good and dense and strong, and they can become more prone to fractures. It won't happen to everybody, but the risk increases. So again, that's good to be aware of now, because it means that we need to look at our diet, our exercise. Are we taking our vitamin D to keep our bones good and strong as well? And then the other quite surprising long-term effect is cardiovascular disease or heart disease, which I'm sure you've seen is the theme of World Menopause Day today. And that's because before the menopause, women's risk of heart disease is lower than that of men's. But as you go through the menopause, it increases and overtakes that of men's. And the sobering statistic is that cardiovascular disease is the commonest cause of death for women worldwide. It's not breast cancer, which many women obviously worry about, and quite rightly, but actually cardiovascular disease is the most important risk factor, the most important cause. And the issue with the menopause is when we lose estrogen, our blood vessels can start to fur up and clog up, and our blood pressure can start to creep up a little bit. Our bad cholesterol in the blood can start to creep up a little bit too. So again, it's good to know about these things now, because we can do something about it. These are modifiable, changeable, improvable risk factors.
Absolutely. I mean, it is as much as possible, and I know it can be an absolute juggle. It is about looking after ourselves as much as possible, and, you know, trying to eat correctly, trying to kind of make sure our movement keeps up throughout.
Yeah.
And also social connections as well. It's all kind of all ties in. Tell us, how are we going to kind of be able to, if we need an alternative, what are the treatment options that we have at our disposal currently here in the UK?
Yes, no, absolutely. So I'll talk about each one a tiny bit, and then we can dial back and talk in detail as we need to. So lifestyle changes is a big one. Yeah. So it won't surprise you to hear me say that reducing alcohol, stopping smoking, exercising, and really looking at your diet can take the edge off menopause symptoms and can help reduce those long-term health consequences that we've spoken about. So osteoporosis and heart disease particularly. There is the importance of mental well-being. So even just sharing symptoms, you know, realizing that you're not alone. Some women will need coaching in the workplace to help see them through, to learn strategies that will help them keep them where they need to be while these symptoms are passing. And cognitive behavioral therapy, actually, there's really good evidence can help the psychological and physical symptoms of the menopause, which again is often surprising, isn't it, that a talking therapy can help those symptoms. In terms of alternative therapies, then it really is, there are lots of different approaches that many women take. So we've recently done an event on hypnotherapy, which was fascinating. Acupuncture, there'll be Reiki, you know, whatever you're into. Although the evidence is lacking, but if you like reflexology, if that's something that works for you, that's great, unlikely to do any harm. I sort of put into that branch, and then there's obviously herbal remedies, obviously in terms of essential oils, you know, anything that you can do to relax, to help sleep, to de-stress, just to find time when your brain is literally frazzled, can be super helpful also. There's medical treatment, for example, antidepressants, other prescription medications that can take the edge off. And then, of course, there's hormone replacement therapy, which has been shown to be a really effective way of managing symptoms. But you know what? In reality, it's never just one thing. It's
No.
definitely a holistic approach. It may be that it's looking at relaxation techniques and HRT, and actually, do you need to address diet and exercise? So, a huge range of interventions that can be helpful.
I think that kind of leads us quite nicely on to our blends, which, as we've spoken before about, they are our founders were clearly obviously receiving people in clinic who were going through the menopause. And I think at that stage, it literally was just labeled the menopause. It was a hormonal imbalance, and that was the end of that. And one of the blends that they blended for somebody who came into clinic with the menopause, our support equilibrium, was something that, you know, I kind of now look upon it in a completely different light. It is a sort of a very, we used to call it the hug in a bottle. And now I kind of understand why. There's a lot going on at this time in people's lives. So in terms of ingredients, what we have in there, we've got a beautiful blend of rose, geranium and frankincense. Geranium, actually, there's lots of sort of studies to say that it's been treated. Sort of in 2018, there was a study that was done that saw geranium being used to treat hormonal imbalances, particularly in PMS, for example. Rose for sort of this uplifting, improving anxiety, and sort of that psychological relaxation. And both of those oils, again, really used in sort of massage techniques, or within a massage, helped with menopause symptoms like the hot flushes, like the depression, and as you mentioned, which again is a symptom that's not very much spoken about, which is the joint pain, the aches and general aches and pains. So yeah, our support equilibrium blend was created by our founders and for somebody suffering from menopause. Equally, there's another blend actually that I think is really particularly beneficial and works really nicely in conjunction with support equilibrium, which is support lavender and peppermint. It's a blend that's really very simple with two pure essential oils. So lavender, which is very well known for sort of its antibacterial properties, analgesic properties. Peppermint is very cooling. Originally, actually, it was blended for somebody with IBS, so digestive problems, but later on it was found to be particularly useful for cooling people down. So anyone suffering from night sweats and hot flushes, it's a beautiful, very easy blend to use. Deep Relax. So for those, I'm sure those of you who are fans of Aromatherapy Associates and enjoy using our products, I'm sure you would have used Deep Relax at some stage. Our best-selling and award-winning blend, which was created by one of the founders to help her sleep, basically. Anybody with any kind of sort of issue sleeping, it is an amazing knockout. Or you've got vetiver in there, chamomile and sandalwood. Chamomile was a 2013 study that proved that chamomile actually helped promote deeper sleep. Sandalwood promoting relaxation and kind of just enabling you to just switch off, which, as you said, I think that whole idea of your brain is trying to function and do so many things, actually what you need is rest. Your body needs to kind of rest and stop. And then sort of most recently, as I said, I had never heard, I mean, I heard of the word menopause and obviously it being thrown around, shall we say. But the symptom, that brain fog, is something quite new. I don't think it's been something it's been played out, shall we say, and expressed that this is what it is. It's not just the fact that it's not on early onset dementia. It's not the fact you're just forgetful. It is a real thing, and we've actually we really think that that actually the use of essential oils in terms of things like rosemary, there are studies that show it's really good for memory, and actually in our De-Stress Mind, which is one of the blends that the founders created for somebody who was actually quite stressed, lots of things on the to-do list, and the description that we use of that oil is it's almost like a compartitioning your brain, basically. It's like a filing cabinet for your brain. You've got frankincense in there, which is a beautiful very spiritual oil, really helps to deepen the breathing. You've got chamomile again in there, the petitgrain, which is like the foliage of the orange tree. Those three blends, I kind of looked at in a completely different light. I've been working for the brand now for nearly 13 years, and I've worked with these oils on people. But it's so interesting now with all these kind of, the more we talk about menopause and perimenopause and all the symptoms that we're looking out for, it's so interesting actually. Do you know what, these 4 blends make complete sense, and can make and can hopefully help. And as you say, if you're taking a kind of more holistic approach to your treatment, can help.
Well, no, that's great to hear. Yes, yeah, just being able to de-stress in different ways.
Dr. Clare, do you know, one of the things, and we will move on to some questions. I can see some lovely questions coming through in the chat. So if you have just joined, we are recording the session. So do please keep your cameras off if you do not want to be filmed. And if you do have any questions, pop them into the chat. We're going to shortly go over to the chat. But just to kind of finish off, one of the things that when the last time we spoke, which was kind of an insightful question from me, was when you're wanting to have this holistic approach and you are using aromatherapy or oils, how then do I use my HRT? How do I use it? What goes on first? And what's the best way to kind of get the best the best results out of it?
Yeah, no, that's a brilliant question. And it's all about practicalities of application. So I think that this most applies if you're using what we call transdermal estrogen. So HRT is 2 hormones that for most women, if you haven't had a hysterectomy. So it's estrogen, which generally helps all those symptoms. If you have estrogen by yourself, you need to, so if you have estrogen by itself, it can thicken the womb lining. So you need to take a progestogen if you haven't had a hysterectomy. And some women will also increasingly choose to use a tiny bit of testosterone as well, because we know that that can help libido if the HRT hasn't. So if we just think about the estrogen and how that's applied, then it becomes relevant to then how you apply the oils. So estrogel, this is gel, which with my background you can probably see, and this is a clear alcohol-based gel, and that is 1 dose measure, and you rub that down the back of your arm or your inner thigh, and you need to leave that dry and for at least 2 hours. So you don't want to put anything on those 2 areas for at least 2 hours. So all the way down the back of your arm or your inner thigh. So I think, Christina, that you were talking about where you were applying the oils too. So it's really important that you don't put any essential oil on those areas. You can put them anywhere else, but just not on those areas. Yeah. And then this is the Lenzetto spray. And this is sprayed against the forearm. Now, this needs to stay dry for about 30 to 60 minutes, and then actually you can apply things over. So again, to be on the safe side, you would want to avoid your inner forearm, because that would mean that it just doesn't absorb as well. You're literally rubbing it off if you put things on. The little patches, so if you can see the patch here, these are clear, and these go below the waist on hair-free skin, and you change them twice weekly. So that's another good option. But you really wouldn't want to put an oil onto your skin before you apply the adhesive patch, because they just don't stick. I would probably try and avoid putting oils over. It's fine in a bath, but occasionally the edges will just lift up, and then it won't be as effective. So brilliant question, and hopefully you can see how the practicalities of using this, you just need to take it into account when you're applying your oils.
I think from what you kind of explained, in all fairness, I think it's probably HRT goes on first, and any area that you haven't got your HRT on, you can apply your oils. In the case of the blends that we spoke about, as you mentioned, they are bath and shower oils. They're 30% pure essential oils. They're treatments basically in bottles. So actually, it's a good combination, shall we say. Before we go to our questions, Dr. Clare, I just want to let everybody know that today, and for today only, just for this event, we are giving a free 3 ml support equilibrium to all orders over £50. So if you do want to try the support equilibrium blend, which is that beautiful blend of rose, geranium, and frankincense, which was created by the founders for somebody who came in with symptoms of who was going through the menopause, then for today only and for the event guests only, there will be a link on our chat shortly that you will need to add to your basket to get your 3 ml support equilibrium with your orders over £50. Also, I'm going to take the opportunity to let you know, for those of you who are our treatment fans, we have just launched a new treatment called Pause and Reset, and this is focusing on anybody going through any kind of hormonal imbalances, whereby we completely pamper you from head to toe, using a body brush to get rid of any dry skin. We layer on gels and oils to really help, because I know that's another sort of symptom that we looked at actually, and was quite prominent, which was brittle nails and dry skin. Is that right, Dr. Clare?
Yes, yeah, no, dry skin, absolutely. And we know that your collagen changes as you go through the menopause also, which contributes to that. And brittle nails, yeah, also. And hair can change, the hair follicles can change, texture of hair can change. For some women, that's increased hair loss, for others, it's not. So yes, yeah.
We do have a beautiful hand and foot treatment where we do the pressure points, the acupressures that relate to different organs in the body. So if you are looking to treat yourself and kind of just pull yourself through this, look out on our website. There will be a spa locator which will tell you exactly where you can go to have the Pause and Reset treatment. So on that note, I can see lots of questions coming up. So let's start off. First of all, we have, funny enough, it's a question on skin. So how can I deal with the changes in my skin and hair since my perimenopause started? So how can I deal with the changes in my skin so it's drier and hair? It's just crazy.
Yes, yeah. No, and can be really distressing and annoying. You have to, in terms of skin, I think you have to rethink your skincare routine. I would go and speak to somebody who knows, try some different moisturizers. You might need a heavier or a more oily moisturizer than the one that you've been using. So I'm not a dermatologist or skin expert, but I would have a rethink there. Hair is really tricky and it's so distressing. Some women are programmed to lose hair anyway as they increase in years. And there's not a huge amount that you can do about that. And that can run in families. Some women do lose hair initially in the menopause and then it slows down, and it's more to do with the hormone change. And some women lose hair because as part of the menopause, they're incredibly stressed. And we know that stress can result in hair loss, but that can get better with time. And then if you're having really super duperly mega heavy periods and you lose iron, then loss of iron can also impact on hair loss. So there are many reasons why you may thin during the menopause. It doesn't continue. You won't go bald. But it can be incredibly distressing. If it is something like stress, the hair cycle is generally around 6 months long. So if once the stress has been relieved or you start to be able to relax, feel better, hair loss can often improve. There is a blog on our website on hair loss written by a specialist. So I will dig it out and share it while we're talking.
That's really kind. Thank you so much indeed. And in the meantime, actually, I certainly recommend our Pro Barrier Boost Face Oil. 100% oils for dry skin are just the best. I think as our skin stops producing oil, it's almost kind of us supplementing the oil that it's losing. So the Pro Barrier Boost Oil from our new skincare is beautiful. It's got moringa seed oil in there. You've got blue tansy oil, rose hip seed oil. It's a beautiful blend. If you're not used to using an oil, then certainly use it at night time, but it is a lovely lightweight oil, so really good to kind of start you on that facial oil journey, should we say. So let's move on to the second question, and I appreciate you are looking for your
I know, I'm here.
Are you there?
Yeah.
And I've just lost my chat, which is very annoying. Bear with me a second. Here we go. Question number 2. Lots of actually people have mentioned dizziness. How do they manage dizziness during this time?
Yeah, so dizziness is one of those vague symptoms that has lots of different causes. So the key thing with dizziness particularly, and that can be a feeling of bleariness, of lightheadedness when you're standing. And for some women, it can be more a vertigo like dizziness, which I noticed somebody else has mentioned, where you feel like the world is swinging around you. And vertigo, although it's not listed, and if you Google vertigo and menopause in the scientific journals, it's not widely spoken about. Many women tell me that they've suddenly got vertigo through that menopause transition. And it's the same with tinnitus, where you hear noises in your ear. So what to do about it? The key thing with dizziness is to rule out all of the other causes first, to get your blood pressure checked, get your pulse checked, and you might need some blood tests to make sure you're not anemic, check your thyroid function. And then if you've ruled out all the other causes, then there isn't one quick fix solution. It's making sure that you're aware of it. If you're dizzy when you're standing up, it's making sure you've got something to hold on to. Make sure you're drinking plenty of water, keeping well hydrated, and make sure also that you're eating sort of slow release carbohydrates and making sure there's plenty of protein in your diet, because a lot of the time in the menopause also, your blood sugar bounces around far more than it used to as your body changes how it handles carbohydrates. So they're just some top tips, but it might be something that you need to talk to your doctor about, and definitely rule out other causes before just putting it down to the menopause.
Lovely. Thank you so much. Same question. So feeling faint is feeling faint a menopausal symptom? So I think would you class the dizziness and faintness kind of in the same sort of pot?
Yes, yeah, I would. And sometimes people feel dizzy with a hot flush as well. So yes, yeah, feeling faint.
Makes sense.
Yeah, just that sometimes it's because you're really tired, because you haven't had a good night's sleep. So you can hear what I'm saying. It's difficult to look at in isolation. A good chat with a menopause specialist could be helpful.
And we've got another question in terms of just clarifying in terms of once we've got our HRT, imagine our gels have just gone on or our packs about waiting to put on clothes, for example. How practical is it? How soon after can you put on clothes?
Yeah, so you just need to wait till it's dry. That's a brilliant question. So estrogel takes 3 to 5 minutes to dry, I would say. And the spray, it sometimes dries a bit quicker because it's a thinner liquid. So as long as it's dry, then you can put your clothes on.
I've got just a very random time of day. Is there the best time of day to do it, or is it just as and when is suited to your lifestyle?
Yeah, as long as you're applying it every day, it doesn't seem to make any difference. Some women do prefer to use the gel at night, say, because their worst symptoms are during the night, and you get a peak of estrogen about 4 hours after you've applied the gel. But some women don't like applying it at night because they think it makes them feel a bit wired. So you can play around with it. It doesn't really matter as long as you stick to the same routine.
Question 4, we have how often do you recommend having checkups, including blood tests, if you are on HRT? And do you know, so let's go for that one first, and then there's another one that kind of comes after that. Yeah. So how often for checkups if you're on HRT?
So annually, to really check your blood pressure, check the dose, make sure you're still on the right dose, make sure you've had a discussion about risks and benefits of HRT, just see if there's been any change in medical history over the last year. When you first start HRT, it's good to have a checkup at 3 months, because it does take about 3 months for symptoms to really settle and the HRT to settle in, and then annually after that. We don't recommend blood test checks if you're on HRT, because the blood test for estrogen is really difficult to interpret and misleading. And there's really poor correlation between what the blood test number is and how you're feeling. For example, if you swallow estrogen, a lot of it is converted to an estrogen called estrone, which we don't measure. We measure something called estradiol. So the blood tests aren't really that meaningful. So we tend to only do blood tests if we're worried that somebody's not absorbing their estrogen. So they're on the highest maximum dose and they're still having symptoms. Otherwise, we don't recommend regular blood tests for estrogen. You have to have a testosterone blood. If you're on testosterone, we check it at about 6 to 12 weeks and then annually after that to make sure you're not using too much of it. But yeah, it's easy to get sucked into the blood test thing, isn't it? Because it's nice to have a piece of paper, but actually they're really tricky.
That's really interesting. That's super interesting. And the last bit of the question was, do you know why it's so difficult to get patches? At the moment, it's difficult to get repeat prescriptions, apparently. Is this normal?
So there are two commonly used brands of patches in this country, Everall patches, which I showed you there, and Estradot patches. And Estradot patches are really nice. They're smaller and they're a bit less crinkly. And there is a supply issue with Estradot, and it's a worldwide issue. But Everall should be fine. And the other patches that there are slightly bigger. I'm looking around because I did have one called Estroderm. So that's an Estroderm patch, which is a bit bigger than the Everall patch there, if you can see. And they should be okay. So I would go to a different pharmacy. You might need to phone around, but that is unusual to not be able to get patches.
Lovely, thank you so much. Another really good question. Is there any way to know for definite that you're actually going through your perimenopause rather than trying to guess?
Oh, I know. It's really difficult. It's really difficult because a blood test is not helpful because of the up and down.
Yeah.
But this is why my team at My Menopause Centre, this is why we wrote the menopause questionnaire, which I think I've put a link to in the chat. Basically, it's really difficult because you need to take so many factors into account. Symptoms and how they're changing. If you're having periods, are they changing? You know, are you taking hormones? What else is going on in your life? Because often it is a busy time that can, again, add to stress, etc. So there isn't one definitive test. You need to talk to somebody, talk through it, have a look at all the information that's out there, and have a look at our menopause questionnaire, because that was designed to try and answer the question for you.
Amazing, thank you. And how do you judge when you are on enough HRT? As obviously the symptoms can be vague, so how can we know for sure we're on the right enough HRT?
Yeah, so it's symptoms, it's symptom control. So you generally, you will feel better. You will feel that problematic symptoms resolve. But that said with a caveat, and the HRT doesn't, for many women, take away every single symptom. But say it's hot flushes, you know, HRT is the most effective way of managing hot flushes. If you are very young, under the age of 40, going through the menopause, we know that there's a link between the amount of estrogen and bone protection. So it would be talking to somebody about whether your dose is an adequate dose for bone protection. And that is sometimes when blood tests can be helpful, depending on the type of HRT that you're on.
We have so many questions, Dr. Clare. We are thank you so much. It's super helpful and really eye-opening, so thank you. We have an interesting question. So could you apply estrogel to dry patches on scalp to help follicles?
Good question, but there's no evidence that it will help that, unfortunately.
Lovely. And what do you do if you have an intolerance to progesterone plus HRT affect adenomyosis? Apologies.
Oh, hang on,
Adenomyosis.
let me try and find it.
Yeah. So yeah, first of all, what do you do if you have an intolerance to progesterone?
Yeah, so that is can be really distressing because you need progesterone alongside the estrogen to keep the womb lining thin, and without the progesterone, the risk of cancer of the womb lining increases. So there are a few different top tips of usually if you work with, say, a menopause specialist or gynecologist with specialist knowledge, usually we can find a way of taking the progesterone that is tolerated and is enough to keep that womb lining thin. Many women recoil at the thought of having a Mirena coil fit, understandably, but actually it only gives you a tiny, tiny little bit of progesterone into your bloodstream. So a Mirena coil can be good to consider. There are different types of progestogens in different doses. So sometimes literally, although it's really horrible when you're experiencing distressing side effects, sometimes you literally have to work through different options to see if you can find one that you can tolerate. If you're swallowing progesterone capsules, the body identical progesterone, talking to your doctor about whether it's suitable for you to use it vaginally can be helpful. So lots of tweaks, and you can usually get there. But yeah, it is a really distressing symptom.
And does HRT affect adenomyosis? Is that how you pronounce it?
Oh, adenomyosis. Yes,
There we
thank you.
go.
Adenomyosis. Yeah. So adenomyosis is where the lining of the womb grows into the muscle of the womb. So I will attempt to show a diagram. This is a womb with a Mirena coil in, which I will just take out that. So I don't know if you can see, but the lining of the womb is a darker red lining. This is the cavity of the womb. This is the muscle of the womb. And it grows in, it's where the lining of the womb sort of grows into the muscle. HRT and adenomyosis, a bit like endometriosis, it can be tricky. And you're better off having the type of HRT that doesn't give you a bleed. So you've always got a little trickle of estrogen and a little trickle of progestogen. That can be tricky if you're still having periods. So again, it's a reason to talk to a specialist or a gynecologist, because it can be tricky to find the right HRT for you, but it is perfectly possible. And having a Mirena coil fit can be a really good option in that case, particularly if the adenomyosis is giving you really horrible, heavy, painful periods, which is what it can do.
Perfect. I am going to, there was one question about disturbed sleep. Any tips for disturbed sleep? I know what my one would be, but Dr. Clare, do you want to let us know, what would you recommend for disturbed sleep?
Yeah, so if it's menopause symptoms keeping you awake, manage the menopause symptoms, manage the hot flushes, the aches and pains, the bladder frequency. It's really good to have good sleep hygiene. So creating a routine, relaxing at night, whether it's a bath with some lovely oil in it, or it's reading a book, it's listening to something. Women commonly wake up between the time of 3 a.m. and 4 a.m. in the menopause transition, which is dreadful. If you wake up though, for no good reason, and you find yourself lying there ruminating, thinking, oh no, I've got to get up the next day, I've got to give a presentation, it's going to be bad. It's better actually if you break that cycle, get up, have a herbal tea or something, and then go back to bed a little while later when you're tired again, rather than lying there, because we know you can start to decondition your room to sleep if you're lying there awake and ruminating. Again, on our website, we've got quite a lot of information on sleep that I will quickly search through and put those links in for you. But, you know, really being proactive with managing your sleep is so important in the menopause.
Agree. Sleep is so important for any stage of life. My goodness me, it's so important at this stage as well. Definitely from a aromatherapy associate's perspective, the mist, the deep relaxed mist, having that by your bedside table. If you wake up misting that, actually you can mist it on your body as well as your linen, and doing some breath work. We've got one of our favorite kind of breathing exercises, box breathing. So breathing in for 4, holding that breath in for 4, breathing out for 4, holding it out for 4, and just continuously on that cycle, can help. So that we are our little sort of top tip. I am going to very quickly just ask one last question, Dr. Clare. So, oh, bear with me, I've just lost it. That's very annoying. Here we go. Any non-HRT options that you could recommend?
Yes. So non-HRT, it depends what your symptoms are. So if you've got really awful hot flushes, there are a few medications that can be prescribed. Clonidine is a blood pressure tablet, which helps. All of the sort of standard SSRI type antidepressants and SNRI antidepressant can be helpful. Oxybutynin, there's increasing evidence. It's a bladder tablet, but it can help hot flushes. But generally, it's thinking about, are there lifestyle changes that could be helpful? Is it relax? Do I need to be active? Is it exercise? Is it yoga? Is it relaxation? Are there herbal remedies that I might want to try? I'm not a herbalist. And I would say just a word of caution about herbal remedies in that they can interact with prescription medication, but plenty of women will go to high street stores and try lots of herbal trials. Alternative therapies, so for example, acupuncture, hypnotherapy, Reiki, reflexology, it's really thinking, what are my worst symptoms? Speaking to your doctor to see if there are symptom medications that can be helpful, and then sort of having a look at evidence-based information as to all the other alternatives.
Lovely. Thank you so much, Dr. Clare, for all of that information that, you know what, you cannot hear enough and reiterate it enough, the importance and actually how we do now have that knowledge and the tools to be able to kind of address it in a whole different way. We do not have to shy away. We should be talking about it more and more and more, and the more we do so, the better and easier it becomes for all of us, especially if you are in a workplace, or if you are a homekeeper, if you are a busy woman with a life. This should not impact negatively or too negatively, and you should be able to kind of continue and doing what you most love to do. To everyone that came online this evening, thank you so much. We really appreciate your time. Just a little reminder that if you have been part of this event, there is a little link in the chat that should you go online and purchase anything this evening, you need to add that link to your basket, and you will receive a 3 ml sample of the beautiful Equilibrium bath and shower oil that you can use, that was created by the founders to support menopause symptoms. So do log on, and if there is any other questions, we will hopefully have Dr. Clare back. Maybe this time next year, Dr. Clare will be together again. But on that note, I just want to thank you again for just re-educating and kind of making this so much more easily digestible. The information that you've given us is super helpful, and really clear. So thank you so much. We really appreciate it.
No, thank you for having me. Thank you. It's lovely to be here.
Well, listen, have a very nice evening, everybody, and hopefully we will all be together again at another live session. And in the meantime, have a lovely evening.